Hello, dear friends. Welcome to Aspire32. And today I am here with another one very important podcast. It was requested by some of the viewers in our recent podcast videos, which was uploaded on Aspire32. Till now, we did a podcast on how you can continue working in US after MPH. I also made a podcast with my colleagues who informed you how to do DDS in United States as an international students. We also understood what are the various differences in learning dentistry in India and foreign countries. And today I have Dr. Pooja with me. She's a very good friend of mine. She did BDS with me in India, and after that she did her internship in Maulana Azad, and then she did her dental hygienist from United States, Briarcliffe College, and recently she also joined DDS program. And I have invited her on this podcast because she has a lot of experience of working as a dental hygienist, which maybe most of the international students don't find a lot of information. And today Dr. Pooja is here. Let me first welcome her to this podcast. Pooja, it is a pleasure to host you on this podcast, and I hope to get a lot of information. And I'm sure this podcast will be really useful for all the students who want more information regarding the dental hygienist course in United States.
Thank you for having me, Suresh. It's an opportunity.
So let me first ask you a very simple question that first comes in the mind of every student, especially the international student who want to go to United States. I'm sure there is DDS option, there is dental hygienist course, there is MPH. I want to know why you opted for the dental hygienist course.
Well, Suresh, when I came here, I worked as a dental assistant, and I felt like I was not. It was not. It was a great experience to learn because there is a difference in clinical practice in India and US. And so I learned a lot of things regarding dentistry, but after a certain point, I felt like there were limitations, and I needed to grow. And it's a great career as a dental assistant, but I wanted to be more financially stable as we were migrating into this country. So I felt that going to dental hygiene school would give me more freedom and direct patient care.
So now, as you said, you can be more financially stable. Is it something that dental hygienist course costs less than the DDS programs?
Yes, definitely. It's also, well, I did an associate in applied sciences. So my program was an accelerated program. Luckily, it was close to my home, and it was 18 months. So it is definitely cheaper. As it's also duration wise, it's a lot less.
So here I want to ask you another one question is that what exactly the dental hygienist do?
So a dental hygienist does a lot of stuff in a day. As a dental hygienist, depending on the kind of practice you're working, if you're working in a private practice, you will be setting up and breaking down the operatory. You will be taking radiographs on the patient. You will be taking their medical history, medical and dental history, updating it. You will be doing perio charting. The treatment options that you will be doing would be prophylaxis. You would be doing debridements, scaling and root planings. You are taught to do sealants. You are taught to do whitening treatments. You are taught to place local antimicrobial therapies like Arestins and Atrodox. You are taught to do obviously impression making, and you also have to document all your notes. You are legally holding a license, so you also have to be holding a liability insurance for that. Side note. And then when the dentist comes for a checkup, you will be charting the patient's dental chart. Apart from that, you will be administering fluoride treatment to the patient. Um, I think that's about it. Depending on what they train you additionally to do, it could be coding your treatment, it could be making appointments, it could be doing consultation for orthodontics. Because you as a dental hygienist spend more time with the patient, and the dentist just comes in for an exam for a couple minutes, there is a certain expectation from the dentist that you do talk to the patient about whatever treatment needs they might have. And also on top of that, depending on the practice, sales may be an additional responsibility. And if you work in a corporate office, the role may change. Sometimes you get an assistant for dental hygiene who will be setting up and breaking down the operatories for you, helping you with charting.
So how is the process? Suppose the international student, because you did BDS here, and after doing BDS, you did join the dental hygienist course. How was the process? Is it very similar to getting into the DDS, that is Advanced Standing Program, or is it something different?
If you choose to do dental hygiene, some schools require you to do prerequisites, which could be basically completing courses before getting into the program, which could be somewhere around 1.5 years in duration. Some schools will accept you with the credits that you already have on your transcripts from the school. And the program that I applied to, it basically, so you do need to do a TOEFL exam. That is a requirement. The program that I applied to, which was an associate program, it was only they basically needed my TOEFL, and I had to do two exams, which was a Wonderlic and AccuPlacer exam. Those exams are basically based off on English, math, logic, stuff like that, small stuff like that. But yes, those were required, and once I met the requirements, I was called for an interview, and yeah, it was based off of that. The people in my program were a lot of them were just high school graduates, so it wasn't a very demanding like requirement otherwise educationally. But yeah, but if you have to go for a bachelor program, like I said, you need prerequisites. I have heard of other DDS IDP applicants. They chose not to go for it because it was a long process. Some schools also have a waiting list, so it depends. When you are looking into a dental hygiene program, please check if it is CODA accredited. So CODA stands for Commission of Dental Accreditation. It basically means that it meets the standard of a good program and is accepted. The degree is accepted from that program. And also check when they are due for an a renewal. So I think it lasts for around 7 years. So also check if they are going to get their inspection or whatever done anytime soon, and so you don't end up coming out of a program that is not CODA accredited.
I want to understand two things here. One, you said you worked, you joined as an associate dental hygienist. Does that mean there are some other type of dental hygienist?
Well, you can also be a bachelor, right? You could get a bachelor degree in dental hygiene. So if you want to advance as a dental hygienist, as in you want to, be a clinical faculty somewhere, you need to do a bachelor's degree for sure, and maybe even a master's degree. So, and there are other options of dental hygienists. I think they have extended function in certain states.
So that means you have different levels of being a dental hygienist.
Right. Yes, in certain states, you can practice independently of a dentist. You can have your own practice. And in a lot of states, you need to be under direct supervision or indirect supervision of a dentist.
So can you just give us some example that suppose the state you were practicing, what was the limitation?
Yes, so you are not allowed to diagnose or treatment plan without a dentist's approval. So you cannot do a scaling and root planing unless a dentist approves of the treatment plan or diagnoses that the patient requires it. So that is the limitation that I had. Also, you are not supposed to be practicing on patients when the dentist is not in the same facility or within a certain amount of vicinity.
And the one thing which you did mention that it is easy to get into if you are associate dental hygienist, but how long the process generally goes? Is it like, for example, somebody wants to go into the advanced standing program, it varies from 2 to sometimes the students spend 3-4 years to get into this TDS program. How much time do you think a student would require to get into this dental hygienist program?
Again, that depends state to state. For me, it was easy. I decided and I went, and within a couple days, I was told what the requirements were. I passed the exam. It was simple. I have had other friends who told me that they had to finish prerequisites, which was a duration of 1.5 year itself. And then, like in a state like California, you have to do 4 years, like a bachelor of dental hygiene. So
Do you think that Indian degree, the BDS degree which you got here, did it help you to get into this program? Is it helpful to get in these programs?
definitely, if you're a dentist, the chances of getting into a dental hygiene program should be high. But if they do have certain requirements like a TOEFL exam, you have to do it, right? You just so those things, if you have your ducks in a row, then it's easier to get in. Also, depending on what your credits look like, if they are accepted even from your dental school. When I went to dental hygiene program, none of my credits actually transferred over. So I ended up doing all the basic sciences like anatomy, physiology. Meanwhile, I had two dentists from South America with me in my cohort, and they got like a few subjects off. Maybe like they didn't have to do anatomy or something else.
How much is generally the fees for the dental hygienist course?
Honestly, again, that is variable. For if you're going to state schools, it is cheaper, but they, like I said, they may have prerequisites that need to be completed. Every prerequisite course will cost its own money, depending on the credits that you get. So for me, my course was around $50,000, but it was for 18 months, and got accepted easily. So for me, it just was a great thing that I chose to go ahead because I felt that in 18 months, if I get my degree and I come out, and then I can earn a lot more, so it's completely worth it for me. That's how I felt. There was another state school near me which had, like I said, prerequisites and a waiting list that did not make sense for me.
Do you see a lot of Indian students getting admission into dental hygienist program?
Not really.
And why do you think is the reason? Is it not useful? Do you think for a stable, maybe do you think it's a good career option for students, for international students, if they want to settle in United States?
So what I think is why people do not choose to go to dental hygiene programs is maybe because their requirements to get into the program and the time period of the program may be like unreasonable for them, right?
Okay.
They might not think of it as their career option. They might think of it as something that is going to transition towards an IDP program admission.
So,
Um,
the viewers should know that Dr. Pooja is now doing DDS in VCU School of Dentistry in United States, and that is after 4 years of her being practicing as a dental hygienist. And Dr. Pooja, I want to know that why did you decide to do DDS again?
um, well, I honestly wanted to do it from the time I got here, but it was not so simple to get in. I did get rejected the first cycle, and then as an immigrant, I had a lot of other barriers in getting into school immediately. I also realized that my profile was not adequate at that point. So I went on to doing dental assisting. And then, as I said, I chose to do dental hygiene. And then I think there was a little shift because of my stability that I decided to do dental hygiene. At that point, I decided I would get a master's and maybe be a clinical instructor and maybe do advocacy, for dental hygienists. And then I had a change in my life situation where I decided that I want to pursue my DDS degree because I was feeling like I had a lot more capabilities, and being a dentist would give me a lot more, it would open many doors for me as opportunities. I loved the direct patient care, but I also felt that at some point I felt limited. So I decided to go ahead and apply to dental schools again. This was my third cycle. So this was my fourth cycle of application, but the third cycle since I decided to get back on track to going to TDS.
So was this dental hygienist degree and the amount of experience you had, I'm sure that was really useful for getting the admission into the DDS program, right?
Yes, I think I would say that any US experience that you get over here as an assistant, as a dental hygienist, it all adds up. I did, and it can be impressive to some. I have seen like a lot of people get impressed by the fact that I was working as a dental hygienist, and it gives you a lot more experience and confidence as a healthcare provider. As far as I got, so when I applied the fourth time, I got an interview at Temple University, and I realized that they had an accumulated number of hours of dental experience in US written down on sheet somewhere. So I think they do consider how much US experience you have, and I think that did help me. And it also gives me an extra edge as a future dentist, where I understand the perspective of a dental assistant and a dental hygienist in and their role in a practice.
I just had one question here, uh, because we had one podcast where we got to know that what are the important things one should can incorporate in that CV to get into the DDS program. And one degree what generally the international students do is the MPH program. So just I want to know that is it better to do the dental hygienist course and then go into the DDS program, or you do the MPH and then go into the DDS program? Which path may be a better to the path to take for the international students based on your experience? If you have any comments here.
Interestingly, I did get into an MPH program in January 2020.
Yes, your CV does mention it. Yes.
And then I got into the IDP program. That's why I decided to pursue that first and then put a pause on my MPH degree. I personally feel that dental hygiene is a great course, even if you want to do a transition. Suppose you came to US with the family, you're not ready financially. You do have to do TOEFL exam. I have seen some of my classmates in dental hygiene prepare for their national board one while doing the dental hygiene program, because you are doing a lot of the basic sciences again. It seems like a perfect time to like prepare for the part one and give it. And as you're leaving the dental hygiene program, you could even prepare for your part two. I mean, this is for people who want to do hygiene and then just, as you're going forward, eventually do IDP.
And I think that is really brave, and you are a true example. Most of this, once you are in a comfort zone after a degree, generally many people don't take chances, trying new things, because it is scary to jump into a new goal. But I am really proud, and I'm happy to listen to your experience that even after you get into MPA, you worked as a dental hygienist, and now you are doing the DDS program. You are really brave and a true inspiration for all of us and the students who are, especially the India, who look for guidance. And I'm sure this podcast will help them, motivate them. I had another one question. Since you mentioned about the NBDE, we have part one, part two, and now it has become integrated NBDE. Do you have any exams like NBDE for the dental hygienist?
Um, I think I mentioned that earlier. It was a Wonderlic exam and an Acuplacer exam.
Okay.
They both are based off of English, math, logic, spatial,
Okay.
judgment, stuff like that. Yeah.
No, but we don't have dental subject. For example, NBD part one, part two. I'm sorry. I'm not. If I may have understood it wrong, but what I'm trying to ask you is, for example, we had this ANAT biochem for NBD because I did give part one, part two, and ADAT. Do you have the similar subject for the dental hygienist also?
No, as I said, the program that I went to was an associate, and even high school graduates from US were in that program. So they had no prior dental experience. So that was not required for that. Although this may be sidetracked, when I applied for MPH, instead of doing the GRE, my program accepted my national board exam instead of the GRE score. Not every
Oh,
program does that, but it did help me in that aspect as well.
right. I think that's a good uh, suggestion, or maybe some people may realize, okay, that can be applied, and in their application they can mention it. So you did say that there are limitations, uh, but I'm sure, because last podcast on was on MPH, because everybody says the MPH is like a next step, a step which you have to take before the DDS program. But Dr. Sumeda explained us that with MPH you can continue, have a career ahead. And she did mention that there are growth, that you can grow as a MP, after doing an MPH. I'm sure there must be something apart from the DDS what you mentioned. But if you are purely dental hygienist, what do you think are the growth options for you?
Well, I think I would like to answer that part as an MPH. So, a lot of students are looking at doing master degrees as a sort of upgrade to their profile, so they are better applicants in an IDP program. I personally believe that you should not waste your time or energy on something that you don't feel interested in. You should be sort of passionate about what you are doing. For me, when I applied to an MPH program, I am interested in public health in the future. So I still do intend to finish it as of now because I do want to do like dental public health programs in the future. Um, as far as dental hygiene goes, to get back to the question that you just asked me, um, there is growth. Like I said, my bachelor's degree from India was accepted. So I was planning to do this master's degree anyways, which would have let me be a clinical instructor in the future. Also in a dental hygiene program, maybe, And I also wanted to do the master's in public health because I do want to do public health programs in the future. So it would give me a good insight on the other aspects of healthcare. Um, Suppose epidemiology or many other aspects that we don't know as healthcare providers.
Yeah. And how much, suppose if someone becomes a dental hygienist and maybe he excels in as a dental hygienist also, what may be the earning potential, if you can give us a rough idea?
So, according to the Bureau of Labor Statistics, 2019 median pay, they say it is around 76,000 approximately dollars per year. Yes. But I would like to add that does not mean for every hygienist in every state. It does differ. If just in my area in New York, there was a difference in pay in suppose Queens area of New York, and then there would be a difference in New York City if you're a dental hygienist. And so it depends on the amount of people, the different hygienists out there in the market, and also the population. I would also like to add there is a lot of potential. As a clinician, if you're working in a private practice, you will have a certain amount of base pay, and then well, in US they are paid per hour, right? And then if you work in a corporate dental office, they might give you commission and additional things um, as as a dental hygienist for maybe doing sales or something else like that. So it could add from there your pay. And depending on your education level, if you're a master's or anything else, you can ask for more pay.
And here I want to ask you two important questions, which I always ask in our podcast. The first thing being that, you did your BDS in India. what was the one thing which you carried from here, or you learned here, or something that you developed as an individual, which we learned in dental school in India, which helped you in United States?
Well, I would definitely say working hard because it's so competitive in India. It is competitive everywhere, but that hardworking that you are instilled with in India as a student, with all the competition and ranking, I think that definitely helped me a lot. Um, we are okay with giving tests and preparing for tests, which is great because a lot of students are not happy giving tests. So I think that also helps. I think also being very disciplined and motivated, and I think those things that come from your childhood, which I got because all my education was from India. I think that discipline and hardworking nature, all that helps you a lot to excel.
That's really nice to hear, and I'm sure I do agree for all those the things what you have mentioned. We are really hardworking. And of course, I the next question would be: I'm sure that uh, as an international student, after doing dentistry in India, you went to the United States. Maybe there was something which you really want things to be improved in dental schools, which may be, which may help the students when they think of going to foreign countries to continue their education. Do you have anything which you feel that should improve in Indian dental schools?
Well, when I graduated, it was a bit of time ago. I think in 2009. That was a while ago. So at least I would say is I did not get enough clinical experience. As I see the difference in America and India, we have a lot of dentists over there, and I think because of that, we are like in a position to have to do a master degree. But we're still also a lot of specialists in India. So I think because we are so many specialists in India, we tend to diversify our dentistry towards the specialists. A lot of the dentistry towards the specialists, but in America, general dentists do a lot of dentistry. That even specialists do. So we don't have enough experience when we come to US and get into programs. So at least for me, since I had not gotten any experience, and I came here, I think I needed to learn a lot. I did go to a restorative dentistry program by Dr. Duggins, which helped me learn a lot of concepts. So I would say if you don't think that you are prepared for a bench exam, definitely do a course. That will help. But yes, I think in India we should do more clinical dentistry, more applied dentistry, and less academics.
True. And I think we are heading in that direction. When I gave NBDE or ADAT, I really felt at that time maybe I was a postgraduate, but I did feel that theoretically we are more sound if you have read really well. But yes, when somebody attempts to write that case series in the part 2 of the NBDE, that is where the international students, especially the Indian students, find it difficult to answer, because we have at undergraduate level, I can relate to that, they have very limited information regarding the various clinical cases. I'm sure, I hope that things will improve. And as you said, the you learn concept in United States, which somewhere I also do agree. And Aspire 32, when I try to make videos of any topic, I try to make it as clinically relevant as possible. I really want to thank you for giving so much of information. You are sharing your own experiences and showing the path which you have chosen. But the last, to conclude this amazing podcast about dental hygienist and all the answers what you have given to our very common questions, what would be that message for the students who want to do, international students who want to do dental hygienist course in United States?
I definitely think that becoming a dental hygienist has helped me a lot. I think it's a great career option, even if it's transitionary. If you're just planning to do IDP or DDS eventually, I think it's a great fulfilling career if you definitely are if you have a family and you have other requirements, it's comfortable. You can work as part time. You can work as a temporary dental hygienist somewhere. There's a lot of flexibility. So I think it depends on whatever you want to pursue. But dental hygiene gave me a lot of personal freedom and confidence.
I want to thank you, Dr. Pooja, once again for all this information, and hope to meet you in India again when you come to our institute. As your batchmate, I'm really proud to hear and read and listen to all your experiences and your achievements. Thank you once again for accepting the invite to come on this podcast. Dear viewers, if you like this podcast, click